Good morning, everyone. It's Daniela Jokic from NatRoad. Just letting you know, we are going to be waiting just for another 2 minutes. We are expecting a few more attendees, and then we shall start. Okay. So I can see we've got a good number online, so we might start this presentation. Let's first start with a good morning. I'll introduce myself. My name is Daniela Jokic and I'm the marketing coordinator at NatRoad. So today's webinar is on COVID-19, so safety protocols and hygiene protocols to protect our drivers. And I'll be your moderator today. Today's webinar is sponsored by our Platinum partners, BP and Packer. So allow me to introduce you to our speaker today, David Johns. David has over 20 years experience as a human resources and industrial relations practitioner. Today, David will be discussing how COVID is spread and how to know its symptoms, managing drivers' risks of exposure to COVID-19, the considerations and preparations for long distance journeys that you need to think about, and how to prevent the spread of COVID-19. Now, before I hand over the mic to David to begin his presentation, I do have a few housekeeping items to cover about this presentation. I request that you pop your microphone on silent to avoid any disturbances during the webinar. But I would also like to highlight that we would love to hear from you during today's presentation. If you do have any questions, please type it in the questions pane of the control panel. You should see that on the right of your screen. We will be answering the questions at the end of the session. And once we leave the webinar, there will also be a survey asking you for any feedback. So without further ado, let me hand over the mic to David.
Thanks, Daniela. Welcome, everyone. It's been a while since we've had a webinar, so I appreciate you making yourselves available to join us today. As Daniela said, one of our sponsors is BP. So as the slide indicates, members can enjoy one of the best discounts in the marketplace from BP as part of your membership. Packer is also another one of our sponsors, and they've actually contributed some information that I've utilised for today. I'll address that further as we get to the appropriate point. Now, look, at the end of the day, we're probably all in information overload on COVID-19, but for the purposes of making sure that we all have a common understanding. So you may have heard the terminology of SARS-CoV-2 or CoV-2. What it actually stands for is it's actually severe acute respiratory syndrome coronavirus 2. So where this comes from, people may recall that there was a virus designated MERS, and since that time we've had SARS-1. So the MERS was more an identifier type name from where the virus was first identified. Following that time, because of people's concern or the population's concern identifying a location for the stigma attached to it, it was agreed that there'd be a more general designation, hence we've now got SARS-1 and SARS-2. So SARS-2 is actually the virus strain that causes the coronavirus disease, which is first identified in late December 2019. And as we all know, probably by now, due to the media coverage, the first cases were identified in Wuhan in China when people were diagnosed or suffering pneumonia with no clear reason why that was actually occurring. So what is understood is the same as the SARS and the MERS. The virus originally started in animals, but for whatever reason, and typically being that be it through the spread of animal feces into the food chain, where animals that we end up eating on the table have been contaminated due to the feces dropping into their feed, or where in fact we as humans decide to move to food sources which are probably not as well governed as hopefully our food sources here in Australia. As I've got at the bottom of the slide, even for the time span now and all the efforts in the research to find a serum medication to, if not treat it, but to prevent us suffering from it, there's still a lot that needs to be known about it, and there's a lot of research going on. And that is the element that even now that we're finding out that perhaps there's a little bit more information about how it's spread and some precautions that we need to take. So this is going to continue to be a moving feast at this time. All right, again, just a little bit background. So broadly speaking, coronaviruses, there's a huge group of them, are a family of viruses that can cause illness in humans and animals. Human coronavirus illnesses are generally mild, and typically the common cold is a coronavirus. The flu is part of those groups and things like that, as I understand it. However, there are a whole lot of the coronavirus group to which humans have never been exposed. And so therefore these coronaviruses that we're now seeing coming into the human population can be extremely severe, because, as I said, we've never been exposed to it, so we've never developed an immunity to these things. And as I said, there was the severe acute respiratory syndrome, which we commonly refer to SARS, and the Middle East respiratory syndrome, which was designated MERS at the time. So this is the third significant episode where a coronavirus has moved from animals across into humans. So again, and I'd hope with all the media coverage, everyone's aware what the symptoms of COVID-19 are. And as we've seen through the media, the symptoms can be quite mild, where people almost don't even know they've got the illness, through to serious pneumonia, where people are in intensive care, and at the worst end of it, succumbing to that illness. So again, the typical symptoms: fever, cough, fatigue, sore throat, and shortness of breath. We're also seeing now reports where secondary sickness is coming into children with, I can't remember the name of it, but it's the skin rash and everything, which is causing some concerns there. And hopefully, again, as we are all aware, don't mean to be repeating these things, but as I said, it's trying to make sure we're all of common understanding. So COVID-19 is largely spread through personal contact. It is where we're in a very close proximity to someone when they sneeze or cough, and we inhale the droplets, which, as we all sneeze and cough, little droplets, some may call it spit or whatever, I'm being polite, but the fact is, when we sneeze or cough, there's a whole lot of little droplets released out of us into the area around us, and it's these droplets which, when they contain the virus, that are the real concern. So again, if you've observed when you go to clean something that you, perhaps the monitor or your phone or something, you see little drops on it, it's these items. When you touch the surface, or in fact someone sneezes, they put their hand over the mouth and then you shake hands, that's where the transmission occurs. And it's not so much that transmission, it's then when you touch your eyes, nose or mouth, and that's where it comes to point of entering our body. Okay, so now that we've got that basis, and again, this isn't rocket science, it's pretty straightforward. The risk for drivers, be it heavy vehicle, local drivers, whatever, there's an increased risk because during the early stages with lockdown and everything, particularly the heavy vehicle drivers still allowed to travel across state borders when borders were locked down and everything. And the natural element is that the driver has to interact with people at various locations, be it at the depot, be it at the client site or whatever. So overall, the drivers are exposed to an increased interaction, which naturally just puts them at higher risk. The other elements is that there are high risk factors, which again, looking at statistics across the typical road transport workforce, we've got an aging workforce, so typically medium age is, I think it's 45, 46 plus. So when you look at the increased risk factors, people of 50 years of age and over are at increasing risk to the point where aged people are in that high risk category. People with other diseases, illnesses, diabetes, on blood pressure medication and things like that, all those elements work to increase the risk factors. Now, again, anyone who's right into the safety side of thing, safety specialists love really detailing and depending upon the hierarchy of controls in these things. And so to manage exposure to the disease, such as we've got in this pandemic, is no different to really any other occupational hazard in the workplace. It is something that has to be, we need to have policies, procedures, you need to have done risk assessments and other things like that. So what I've done here for this, and the source of the little graphic on the left-hand side of the screen is from the CDC in the United States and the National Institute of Occupational Health and Safety. So acknowledge the source of the graphic. But again, it's looking at the typical hierarchy of controls for any safety issue. First, we look at elimination to physically remove the hazard, which in this case, yeah, it's pretty difficult to do that. Then we go through substitution, engineering controls, administrative controls, and the last element is to look at PPE. So I'll go into the little bit more detail now in the next slide. So when we look at that, so sorry, just pop back to the first, excuse me, elimination. So we can't actually physically remove the hazard. You know, hopefully if we get a medical, we get the immunization, whatever, then that's where the elimination is. But it's typically not in the realms of the employer's control to actually eliminate anything. So social isolation then is in fact the best element. So to that extent then, we need to limit the contact between drivers, suppliers, customers and others. So one of the things, and we've included this in a model policy and risk assessment that we've got available on our website. What we're suggesting to members is that, in fact, to engage with your regular customers, clients, whomever you're doing deliveries for or transporting goods for, about measures that they have in place and measures that you're putting in place, so that there's a common understanding when your drivers go onto their site to do the delivery. The other elements then is to make sure that drivers are aware of the social distancing requirements and look to follow those social distancing requirements, ideally remaining in their vehicles. And the same sort of thing as when we rock into the stores these days. Don't know about everyone attending, but I've found that a lot of people don't actually want to accept cash these days. So it's all electronic. And I think even for some of the older people around who may not have used the pay facilities on your mobile phone, we've probably been motivated to actually activate those features. So if we then translate that into what a driver needs to do, it then comes over to the same sort of thing. Is there a contactless method, such as using a mobile phone or tablet, to communicate with customers, get an acknowledgement of some kind in relation to the delivering of the goods? The same sort of thing extends then into using electronic paperwork wherever possible. You know, if there is a signature required, what other ways can proof of delivery be established, be it by photograph, be it by you know, a text from the person receiving it to a mobile number or something like that. Key element, and I'm pretty sure most people have this already in place, drivers not having passengers in their vehicle. That way then, at least only the driver is in the cab. So again, trying to limit that possible transmission of the disease. And again, because look, I'll cover it later on in the slides, the best cleanser is using soap and water. But again, we do acknowledge that in fact out on the road, it's hard to keep a supply of sufficient amount of water. Whether you can carry a bar of soap, it's pretty easier. So it's key to ensure that wherever possible, drivers have a sufficient supply of hand sanitizer and perhaps disinfectant wipes. And hopefully after that initial glut where people were buying up hand sanitizer and things like that, supplies have steadied now. Okay, so then if we do exclude people apart from the driver from the cab of the vehicle, then that's one way of limiting transmission. But it's also, again, acknowledging that a key way of preventing the transfer is cleanliness and regular cleaning of things. So how do we look at sanitising the vehicle? Now, a key element we must reinforce to everyone is before using any publicly commercially available cleaning agent, you should check the vehicle operator's manual or with your vehicle manufacturer, as some use of some products may not only avoid the vehicle's warranty, but they will potentially damage elements within the cab. Again, as I've got on the slide, the best cleaning element is mild soap and water. It is the preferred choice and it's the least risk to various elements within the cab of the vehicle. And definitely don't encourage anyone to stand there with the hose and spray out the vehicle. For the people who are really pedantic about cleanliness, it is not a preferred one, but diluted bleach, and based upon information given to us by PACCAR, who in relation to Kenworths and DAF trucks, their definition of diluted bleach is 21 mils per 1,000 millilitres of water. This can be used in limited applications, but it's not intended to be a long-term cleaning agent. So look, this is information we've put together. we do have a full sheet detailing what the PACCAR group recommend for their vehicles. Volvo, Mercedes are of similar lines, but the key element that they all stress is mild soap and water. So what I'll just take you through in the next couple of slides is what again is recommended. So interior vinyl trim, switches, controls, instruments and hard trim, again, always mild soap and water. And it's important on all these items that you do not use bleach or diluted bleach, alcohol or ammonia, as all these items can be damaged. The most important part of the vehicle is the seat belts. And in fact, the use of anything apart from mild soap and water can really affect the effectiveness of the webbing and the stitching. So where you do have someone who really wants to get down to cleaning it, the diluted bleach is only acceptable for the metal and plastic buckle components. Definitely, as I said, a no-no on the webbing or the stitching, as it will deteriorate both those products, thereby making the seatbelt not effective and needing replacement. Also, do not use alcohol or ammonia. The steering wheel, again, look, leather steering wheels, even with mild soap and water, be very careful not to soak the wheel, but also you need to follow up with some leather conditioner, because over time it will take out those elements in the leather so it won't have the same look, and it'll start to deteriorate over time. Alcohol and diluted bleach may be used, but it will dry the leather even quicker. And while leather conditioner does reduce the drying effect, it won't eliminate completely. So over time, it will damage the leather and the appearance of it. Steering wheel, any other ones, just again, same as for the leather wheel, but they recommend not using alcohol. Handles, doors and grabs, mild soap and water or the alcohol diluted bleach. Seat cushions, where it's fabric, ideally fabric cleaner provided by the manufacturer of the vehicle or a reputable commercial product, or steam clean. The easy fix is the mild soap and water, but again, don't soak the seat. Have the wet cloth or whatever with the wipe it on, and then try to wipe it off to make sure that there's not a whole lot of water left sitting on the seat. As I said earlier, don't turn a hose on inside the vehicle, and particularly don't use high pressure cleaning equipment. And very importantly, for later vehicles that have information screens, particularly where they're touch type, there is a film and anti-glare treatment, and so these screens are very sensitive to chemicals. So ideally, mild soap and water, LCD cleaners, but again, make sure you read the label and check with the manufacturer of your vehicle that there is nothing in that cleaning product, even the LCD cleaners, that will cause problems with the screen in your vehicle. And above all, bleach, diluted bleach, alcohol, and ammonia will cause problems to that screen over time. Okay, so cleaning of the vehicle, all covered off. As I said, we've got a sheet which we'll make available. But again, if you have any concerns, please approach the manufacturer of your vehicle, because at the end of the day, we don't want, where a vehicle is still under its manufacturer's warranty, the use of some items may void the warranty, and that's the last thing we'd be wanting members to experience. Now, for the driver, one of the things that has become very clear as we've moved through the last few weeks and month is that with a lot of the limitations or bans put in place by not only the federal government but then by the state governments, food outlets, restaurants and things like that have all closed. And initially that directly impacted all the truck stops, even to places where facilities, public toilets and things like that. So one of the things you really need to, particularly for long distance drivers, you need to do some trip planning prior to drivers heading off. Hopefully you've all done these things, but if you haven't, now is a good time to be doing that. So again, it was a bit tough to be sending a driver out there for him to be buying his food, but not being able to sit down and eat it in a comfortable place. Also not having access to showers and things like that. So they were really sort of confined to the cabs of their trucks. So again, there's now guides on the National Heavy Vehicle Regulators website where you can access a map on facilities and other things. There's a couple of other applications that we're aware of. If you have any questions on those, please don't hesitate to drop us an email or to give us a call. Also, the border controls, we've been publishing regular updates that are available on our website in relation to what is required where you have drivers crossing borders. People moving into South Australia, drivers moving across into South Australia need to be aware of some recent changes in relation to requiring to keep a list of contacts. We're actually trying to address that with the state government because we find that a little bit over the top. However, in order to be compliant, these things need to be met. The same thing at the moment, it seems like Queensland, Western Australia, I think the Northern Territory and Tasmania are going to keep a lot of restrictions in place, even as we see New South Wales moving to open up borders, etc. If you're moving into Queensland, you don't need to have a permit, but again, give us a call if you've got any concerns about that. So, yep, that's just a slide bringing it together. So again, pre-movement between ACT and New South Wales. Here in Canberra, we've typically followed New South Wales, and there was no real movement restrictions between the Territory and New South Wales. As Daniela indicated, this slide set's going to be available plus a recording after this anyway. But look, as I said, if you have any questions, Brett, Richard and myself, we love talking to our members and we're here to help. As I've suggested, we've gone through a period where a lot of facilities were closed, so it is good to look at the routes that your drivers are going to be travelling, having a bit of a conversation with them and trying to make sure that they can in fact access places along the route. I'm pretty sure we've all spent periods, whether we've been camping or whatever, where we haven't got all those facilities available to us on a daily basis. And I think at the end of the camping trip or whatever, we can all understand it's not probably the best feeling. Now, there are some exemptions there, but rather than trying to click on it and muck about with it on the screen, if you've got any concerns with that, please give us a call. As I said, the NHVR have got a map of open sites. Look, as I said, rather than click on the link, it's easier perhaps if you give us a call and we can provide you with that, the details of where to access that information. One of the other things to be very mindful of is where your drivers are heading, because we have found that a number of businesses, distribution centres, depots, as part of their work health safety response to COVID-19, they actually closed their facilities to visitors, including drivers bringing things in. So attitudes were actually pretty poor. Oh, well, there's a petrol station down the road. The drivers can actually use the toilets before they get to our site, which is all well and good. But if they're waiting to unload and you go over a period of time, we don't have mass storage facilities built into our bodies. So a lot of the distribution centres and others have rethought, because again, under the Work Health Safety Act, or the Occupational Health and Safety Act, which still exists down in Victoria, the duty to consult, and in fact, reading the legislation, it's not just duty to consult with your workers, it's a duty to consult more broadly. So in actual fact, shutting it down and not allowing drivers to use the facilities could be seen that they didn't meet their consultation requirements. So hopefully most places have addressed that, but you need to be aware because there's still some places which are not allowing drivers to use their facilities, unfortunately. So once they're out on the road, again, we do have areas now where the facilities have been allowed to reopen specifically for truck drivers. But again, the need for social distancing, good cleanliness, so washing, sanitising hands, particularly before sitting, getting ready to eat some food, and then prior to leaving. There's also limitations on the amount of time, and while some of these limitations are being reviewed, it's still good to observe a 1 hour limit to being in a certain location. Also then, it's really good to have an understanding as to how often the driver's lounge, the facility, is moving through and cleaning, showering and toilet facilities and things like that. Because to be fully compliant, they needed to have raised their game and to be moving through and cleaning those facilities a hell of a lot more than what they used to. Again, I don't know about other people, but when I was in the military, we were all encouraged to wear thongs into the shower and things like that. It's also very much to be aware of any surface where personal body fluids may have landed, and to be aware of just the cleanliness and how frequently they're cleaned. Hopefully the facilities do that heightened cleaning regime. There should be instructions around for your drivers to follow as well. Key element though, and this goes to any part of it for any employee, if displaying symptoms of illness, particularly those which could indicate that they're suffering symptoms of COVID-19, do not go into the lounge and instead seek that medical assistance. So once you get to the site, as I said, social distancing, personal hygiene practices, regularly washing or cleaning of your hands, and I'll cover off again why soap and water is always better. While in many instances we have to use hand sanitizer, soap and water wherever possible is always the best way to make sure you're cleaning your hands. As already discussed, stay in your truck if possible. Avoid hand contact with anything on site if possible. And I think we've all seen places moving to the point where a person puts the box on the ground and then someone else picks it up rather than directly getting right into their personal space and handing it over. Use of disposable gloves, sanitised surfaces and things like that. Disposable gloves can be a risk if you're not putting them on or removing them properly, or if you then go, even with the glove on, to be touching your face, that increases the risk. So if you need to move to that path, you need to make sure that drivers are properly trained and aware of the risk elements if they don't do that properly. Loading, unloading, if slight personnel can be used, that's always the best. If your driver has any concerns, it warrants an incident report to be lodged with you, because again, as we see, there are sites where, such as the McDonald's, where in northern Melbourne, where 12 sites have been shut for deep cleaning because a delivery driver had tested positive, but it looks like the contact was limited, and so the transmission at this stage, I'm not aware, has been confirmed. Just a little bit deeper on the proof of delivery. Again, have the conversation. Contactless is always best, including not requiring a receiver's signature. As I said before, alternatives to the signature: record the receiver's full name, title, date, and time. Maybe even get approval to take a photograph of the person with the item. Excuse me. Email real-time delivery of confirmation, or text message, perhaps. The use of your if your trucks are fitted with telematics, the use of that data to be able to clearly show that the truck has been in that location, etc. Photos of the goods at the delivery point. Because COVID-19, if I recall the data, it has been indicated that it can remain active on hard surfaces. Hard surfaces, I think, is a bit longer, but paper and cardboard for about 3 hours. The whole fact of it is to reduce the number of people handling documents and other things like that. Okay. Again, probably getting a little bit sick of hearing some of this, but the key elements and part of the WHS, OHS requirements are making sure that your workers, therefore drivers, are clearly educated on the steps required to prevent the spread of COVID-19. The key element, and again, it may be that I'm harping on this, it comes down to good personal hygiene. So the washing of hands frequently with soap and water. When you don't have soap and water readily available, and look, there may be circumstances where you can chuck a 20-litre container of water with a little tap on it into the vehicle. As I said, it's not too hard to have a cake of hand soap with you because it is the best. But where you can't do that, alcohol-based, and it's a 70% minimum alcohol-based hand sanitizer for when soap and water are not readily available. It's important that everyone covers their coughs and sneezes. Use the tissue or the upper sleeve. If you're using tissues, immediately throw the tissue in a bin and make sure then that the driver, we encourage drivers in that to wash their hands. It's key to ensure we don't share food, drinks, and personal items, including mobile phones, and hence contactless deliveries and things like that. And as I've got at the bottom of this slide, again, if anyone is showing symptoms, not feeling well, we need them to stay home and to seek medical advice. Okay, so it's also increasingly going to be required that not only do we have the need to have posters, the same as any safety poster, safety posters on COVID-19 around the workplace to ensure that we're meeting our obligations to take every step reasonable. It's also important to make sure that we all know, including our workers, our drivers, how to wash their hands properly. This might sound like a little bit being silly, but for anyone who does work in health, has worked in health, again, typically as part of induction, ongoing training, apart from manual lifting and all that, is particularly when you're dealing with patients who may be infectious and things like that, being taught how to wash your hands. And I think we all see movies and things like that where doctors or and other people are cleaning their hands prior to going into surgery. So this is just an extension of that. So basically it is washing your hands thoroughly with soap and water for at least 20 seconds. So that's down in between the fingers and everything, making sure you clean it off well with running water, and then using a clean towel or air to dry the hands. Excuse me. So as I said, I was going to go into more detail about why soap and water, regardless of anything else, it's still the best item available to us to make sure that we are properly cleaning our hands, and this goes to killing the germs and everything like that. And the reason for this is that a decent lot of soap contains fat-like substance, which amphilites, I think it is, if I'm saying it properly. So they are very similar to the lipids in the virus membrane. So basically, the soap competes with these lipids, and it actually allows the penetration and the breaking down of the virus, so that it actually comes off the skin and cleans the hands quite well. So while alcohol-based products, hand sanitizer and that work equally as well, the fact is when we're washing our hands with soap and water, we are actually covering more or cleaning more rather than just the touch surface. We're cleaning the back, between the fingers, up the wrist a bit and everything if we're doing it well. Whereas when we're using hand sanitizer, unless we're going to use bucket loads of hand sanitizer, we're probably not cleaning as much of the surface of our hands as we do if we're doing the cleaning of our hands properly with soap and water. So as I said, only need a fairly small amount of soapy water, whereas we need to use a lot more to clean the entire hand with sanitizer. However, at the end of the day, we use what is best and what is available to us at that time. Also then, from a driver's perspective, because of the increased potential exposure, good personal hygiene helps protect us again, because the clothes that we wear and other things like that, look, as the virus can live outside of the body for different periods of time depending upon the surface, we just need to look at our personal hygiene even higher. So covering your coughs and sneezes, elbow or a tissue, putting it in the bin, washing hands as often as we can with soap and water, but particularly before and after eating and after going to the toilet. Key element, avoid touching our eyes, or this is for anyone, not just drivers, eyes, nose and mouth, because that is the direct entry points into our body for the infection, hence why the whole issues with sore throats and other things like that. Clean and disinfect frequently used surfaces. Clean and disinfect frequently objects that we use, such as mobile phones, keys, wallets, and work passes. And the same thing, be very careful what you clean your mobile phone, wallets, other things, because certain substances will break down or interfere with the item that the such as a wallet that is made of. So again, if you use alcohol and other things like that on wallets, you're going to deteriorate the leather. So look, there's a lot of information there, and hopefully a lot of people have those things in place. As I said, we have a template policy on COVID-19 available on our website, or by dropping us an email or giving us a call. Also have a template risk assessment, which you can modify and expand so that it gives you guidance what to be looking at in your workplace and what things to put on. So again, look, I'll hand over to Daniela for the questions and other things like that. But apart from that, what I would encourage you to do is to have a really good think. And even outside, once we close this webinar off, would really love to talk to you or have an email from you so that we can go into those things perhaps in a greater detail. But Daniela, I'll hand it back to you.
Thank you, David. Well, we actually have no questions from our attendees, but I just do want to highlight, as you said, members are very much encouraged to call us on 1800-272-144 or email info@natroad.com.au. If you do think of some more personalized questions that you want some advice for, our team is there to help you. So definitely want to say thank you for presenting, and to all our participants. The webinar will be emailed by Monday. The Packer cab sanitation fact sheet is available online, so that is for the Duff and Kenworth models. That's on our COVID webpage. So if you're not aware already, do go to www.natroad.com.au/coronavirus, or if you just pop on our homepage, you'll see it in the main slider, and there's a lot of useful information on there. But if there's something that is missing, please do let us know. Oh, we've actually had a question pop in, David. The question is, when you say soap for cleaning a truck, do you mean detergent? What kind of soap is it?
Yeah, so again, the typical cake of soap can sometimes be difficult. It's mild soap, mild detergent solutions in water, which is ideal. So again, it's if you have to, cake of soap, leave it sit in the water for a little bit and stir it up. But that is the best recommendation from everyone that we've spoken to. Look, again, just on that, one of the things I would like to reinforce is the same as any safety element. Until we get a vaccine, there is going to be that increasing expectation from the safety regulators, from clients and other people, that you have done risk assessments, you've got policy procedure in place, and that you're taking appropriate steps to demonstrate that you're dealing with all this. That is the same sort of thing, the training, the whole lot. It's the same as any safety situation. If something comes up, you're going to need to be able to demonstrate that you've taken all reasonable steps. And in actual fact, I don't want to worry people, but the element is there are already lawyers and other groups running around trying to canvass some work on the basis, if you've contacted COVID-19 through your work, you should file a workers' compensation claim. Now, again, typically we might associate that with people who are directly exposed on a regular basis, such as our healthcare workers and other things like that. But unfortunately, I think we all do recognise there are areas there which people will try to, heaven forbid, do I use the term ambulance chasers. So again, as part of making sure that you can demonstrate you've taken all reasonable steps, it's important you do the same sort of things as you do for any other safety issue in your workplace. So Daniela, is there any other questions or anything?
No more questions. So I think that concludes today's webinar.
So look,
and I wish everyone
sorry, just as I said, Richard, Brett and I, we're available. We will continue to be available, and there's no silly questions. So drop us an email or give us a call.
Fabulous. Thank you so much, David, and to everyone, hope you have a fabulous day. Thank you.